All right. So, hi everyone. My name is Garrick Lim. I'm a physical therapist working at React Physical Therapy out of the West Loop. Real quick, I wanted to thank Michelle from 9 Round Fitness, as well as Ashley, our Director of Business Development, for setting this webinar up for all you guys. I'm going to be talking about what I think is a very important topic in terms of shoulder health with especially boxers. And that is the rotator cuff group in the shoulder. Before I get started, if any of you guys have any questions, John, if you guys open up the chat box, he's another physical therapist that will be with us today. He's going to be our panelist, so if you guys have any questions, feel free to type it out into the chat box. I have it open as well, so I'll try to keep everyone up to date on what is being asked throughout the presentation. All right, cool, let's get started. So, like I said before, I'll be talking about the rotator cuff muscles. I think of them as the forgotten muscle group in the shoulder because when you go to the gym and if you talk to anyone, chances are they either don't know what the rotator cuff is, or they do know what it is and they don't really do anything to help strengthen or train it, which is very important because to me, I think the rotator cuff is one of the most important, if not the most important muscles in the shoulder in terms of maintaining shoulder health and motion. And if you don't have proper strength or training with the rotator cuff, you're basically setting yourself up for pain or injury in the future. So before we get into what the rotator cuff is, it's important to know what the shoulder joint is exactly. So there's a couple of different joints in the shoulder. The main one that we're going to be focusing on today is the ball and socket joint, or this green area in this middle picture here. So the ball and socket joint, like in the name, it's made up of a ball and a socket. The socket being the glenoid, which is this green line here, and then the ball is the top of your upper arm bone, which is over here. As you can see in the picture, the socket is pretty shallow. It's not as deep, meaning that that ball has the possibility of moving all around in the joint itself. So it requires a lot of stability from the structures around it, one of which is the rotator cuff. The shoulder joint is a multi-axial joint, meaning it can move in all different directions. It can go up in front of you, behind you, out to the side, and rotating both ways. So again, it requires a lot of stability so that the ball stays in the center of the socket and doesn't have the possibility of moving in either direction when you move your arm. Because it is the most mobile joint in the body, it also is the most commonly dislocated joint. So just another reason why it requires a lot of stability from the rotator cuff. All right, so what is the rotator cuff? The rotator cuff is actually a group of 4 muscles that sit all around the shoulder and provide stability for that ball to stay in the socket. The first muscle is the subscapularis. So if you look at this picture over here, this is actually looking at it from a frontal view. The subscapularis sits in front of the shoulder blade, and it protects the joint from the front side of it. Next up is the supraspinatus, which is this green muscle on top. So that covers the joint from the top. Below it in the back, so now this picture is looking from a back profile. That's the infraspinatus. It protects the shoulder in the back. And then below it is the small muscle, which is the last rotator cuff, and that is the teres minor. All right, so what does the rotator cuff do exactly? So we already know that the rotator cuff is responsible for stabilizing that joint, so keeping the ball inside the socket. If you look at this picture over here, whenever you go to move your arm, all those muscles are responsible for contracting or shortening and pulling that ball deeper within the socket so it it doesn't have the possibility of excessively moving in any direction. Aside from that, each of the muscles have their own individual or unique functions as well. So the infraspinatus and the teres minor, if you remember those two muscles that protect it from the back, their individual functions are to create what we call external rotation of the upper arm, and that is rotation of your upper arm bone away from your body, so rotating it backwards. The subscapularis, if you remember, that's the muscle that sits in front of the shoulder blade. It's responsible for doing the opposite motion, which is internal rotation, or rotating the upper arm bone toward or in front of your body. Not listed here is the supraspinatus. So the supraspinatus, it's a really small muscle, and because of where it sits on top of the shoulder, it doesn't really contribute to much else besides stability. What it does do is contribute to about 15 degrees of elevation out to the side. So helping to lift your arm out here. Again, it only contributes to about the first 15 degrees. After that, then your delts start to kick in, and then your upper trap. So compared to all the other rotator cuff muscles, it doesn't do much other than providing stability for the shoulder. All right, cool. At this point, it's important to discuss the difference between internal rotation versus external rotation with the rotator cuff muscles. So as you can see from this slide, I listed all the muscles responsible for internal rotation compared to all the muscles responsible for external rotation. So for internal rotation, we have the subscapularis, which is that rotator cuff muscle that sits in the front. We also have a lot of other different muscles in the upper body. The big one in your chest, which is your pectoralis major. The latissimus dorsi, which is that muscle that sits on the side over here, the biggest muscle in your upper body. The anterior delt, which sits in front of the shoulder here, and then also the teres major. So if you look at that list compared to the external rotators, you have your two rotator cuff muscles, the infraspinatus and the teres minor, which sit in the back of the shoulder, as well as some fibers of that posterior delt, which sit in the back of the shoulder as well. So you can kind of see there's like a discrepancy between the amount of muscles responsible for internal rotation compared to the muscles responsible for external rotation. So that's kind of one of the flaws, I guess, that in the human body that's evident. And it kind of sets us up for failure because there's that imbalance in how many muscles are pulling our shoulder forward versus how many are able to stabilize it in the back, which makes it even more important for why we need a strong rotator cuff in the back, especially to help maintain that balance to keep a healthy shoulder. So moving forward, I'm basically going to be explaining the importance for why we need to strengthen the external rotators, specifically the infraspinatus and the teres minor, in order to keep a healthy shoulder functioning. All right, cool. So why is the rotator cuff important for boxing? So you're all members of 9-Round Fitness, so you've all have had some experience with boxing. We know that boxing is a very dynamic sport, meaning that you're constantly moving your arms, whether it's to throw a jab or to parry a jab or block a punch. So every time you go to move your arm, you're requiring activation of that rotator cuff to keep it stabilized within the joint or within the socket. Boxing is also a very high impact sport, meaning that every time you go to throw like a power punch, like one of your crosses or your hooks, every time you make contact with either the bag or a pad, you're creating a force of impact that is going to travel into your arm and go into your shoulder. So with that force of impact, you're requiring more activation of the rotator cuff to be able to stabilize that ball in the socket against that force of impact. With a weak rotator cuff, you have the possibility of that ball in the socket excessively moving inside a joint, which can create a lot of different problems, including like clicking, clunking, damage to all the other structures around it, which is very bad. And then also with boxing, one thing that's very unique with it is that everything is essentially done in front of your body, kind of in this small square from your head all the way down to your torso. As compared to other sports, which may require like throwing motions or reaching or twisting behind you, boxing is very situated in front. And because of that, in order to keep a safe and guarded position, you're essentially putting your shoulders into that internally rotated position. If you look at all these pictures on the side, whenever you go to throw a punch, you're internally rotating your shoulders. Whenever you're going to block or parry a jab, you're pulling your shoulders forward to kind of create less space for that punch to get through. So going back to what I said before, how we already have that imbalance of internal rotation, this sport essentially requires more internal rotation from your body, which makes it even more important for why we need to strengthen those external rotators in the back of our shoulder. All right, cool. So moving on, I'm gonna start getting into the demonstrations for what you can do either at home or in your workout programs to kind of help make sure that you have a healthy and strong rotator cuff so that you can stay injury-free whenever you go to train. So the first thing that I'm going to talk about is an active release. For those of you who don't know what an active release is, it's different from your typical strengthening or stretching exercise, and it basically helps to release any stubborn tension within your muscle to help it function more efficiently. So you can get tension in the muscles a couple of different ways. If the muscle is overused, so if you're overworking it or overtraining it, or if you're even undertraining it, tension can build up in muscles. And it develops what I like to call restrictions, or what you guys may know as like muscle knots. And basically what that is it's a tight band of muscle that just doesn't do what it's supposed to do. So we know muscle fibers, when you contract them, they shorten. When you lengthen them, they elongate on each other. A restriction or a muscle knot is basically fibers that don't slide along each other anymore. So that's where the active release comes in handy. There's two different components of an active release. The first one being deep pressure using either your fingers, or I like to use a ball, either a lacrosse ball, tennis ball, or baseball. And that's meant to help put pressure onto those tight areas to kind of help let those fibers release on each other. The second component of the active release is the active movement. And that is basically you taking your arm, in this case, doing an active motion. This will either be internal or external rotation, to kind of help facilitate the movement of those muscle fibers so that they become unstuck with the deep pressure, and then they get used to moving back and forth again. So I'm going to get out of the share mode so that you can all see me. So I'm going to be using a lacrosse ball here to get to the rotator cuff. So how you want to do it is find any tight areas in the rotator cuff and the external rotators on the back of your shoulder. You're going to know that it's tight when you put a little bit of pressure on it and it kind of feels a little bit tender or uncomfortable. That's a good indicator that you're on a good spot that needs releasing. So for me, that's going to be about right here. So I'm going to take the ball, I'm going to put it on that shoulder, and then I'm going to put it up against a wall or some sturdy surface. And then like I said, so there's the deep pressure, and then we're going to include the active motion, which is going to be going in and out of internal and external rotation of the shoulder. So you want to stay on one spot for about 20 to 30 seconds to make sure you get a good release of those fibers. And then chances are you're probably gonna find different areas that you're releasing. So then I would move it along that muscle belly, find another spot that's a little bit tender, and then again, go in and out of internal, external rotation and stay on it for about 20 to 30 seconds. Cool. So that is the active release. Again, this is really good for making sure that the muscle is nice and loose and warmed up before you do any kind of strengthening or activity to it. So I would always recommend doing the active releases before anything else. All right, next up, we're gonna go into strengthening the rotator cuff, specifically the external rotators. Like I said, we're already overcompensated in all the internal rotators because of that imbalance that we talked about before. So it's very important that we focus on the external rotators because that's where a lot of the weaknesses and imbalances are gonna be. So what I'm gonna show you right now is kind of a progression that I like to use to progress the strength in the external rotators of the rotator cuff. So the first one I'm gonna show you is going to be an isometric contraction, which is this picture all the way on the left. And basically what you're gonna do is, I'm gonna exit out of the sharing. If you're strengthening your right rotator cuff, you're gonna go up against the wall with your right arm. And I'm maintaining this 90-degree angle at my arm over here and putting it against the wall. I wanna activate my rotator cuff, my external rotators, by thinking about pushing with my fist into the wall. So I'm thinking about creating this external rotation motion, but it's not gonna go anywhere because the wall is gonna be stopping me. So you're pushing against the resistance of the wall over here. You wanna hold each one for about 5 seconds, and then take a short break for about 2 to 3 seconds, and then do it again, press into the wall with the fist, hold for 5 seconds, and take a break. You wanna do that about 8 to 10 times per set for 3 sets total. So the 8 to 10 reps per set with the 3 sets, that's going to create a change in the muscle fibers into what we call hypertrophy. And it's good for building muscular strength, muscular endurance, and muscle size, which is all going to be very important for what you want the rotator cuff to do. All right, cool. So the next exercise, once that becomes easy, is going to be with the use of a resistance band. So I have my band set up over here. You want to make sure that it's tied or secured to an object that isn't going to move. So I have it on this door handle. And what you're going to want to do is you're going to keep that same position that you did in the first exercise, which is maintaining that 90-degree angle of the shoulder. So here I'm going to be working my left rotator cuff. And you want the direction of the band pulling you in the opposite direction of external rotation. So to start the movement, you want to keep your elbow tucked by your side over here, and then you want to pull against the resistance of the resistance band, and then slowly bring it back in. Pull, and then slowly bring it back in. Same thing with the other exercise. You want to do about 8 to 10 reps per set. Take a short break after each set, and then do about 3 sets of those. All right, and then once that exercise becomes easy and you want to progress it to the next one to challenge yourself, you can come up here, so bring your arm up to a 90-degree angle over here. And then the same concept, you want the band pulling in the opposite direction of where you want to go. So for us, external rotation is going to be in this motion over here. So you want the band pulling in front of you, away from your body. So same thing, 90 degrees at the elbow, 90 degrees at the shoulder, You're going to create external rotation now, rotating on the axis created by your upper arm bone, and then slowly bring it back down. So do 8 to 10 reps again per set for 3 sets total to create that change in hypertrophy that we want for your muscles. Cool. And then the last progression from here, once this gets pretty easy for you, you're going to do the same motion first, which is pulling back into external rotation here. And then from this point, to challenge the rotator cuff even more, you want to perform an overhead press, which is here maintaining that external rotated position of the shoulder. Come back down from the press, and then come back into a neutral position of the arm. So again, you're going to pull into external rotation. You're going to press overhead, come back down, and then rotate back into neutral. So same thing, perform 8 to 10 reps per set for 3 sets total. All right, so that is a very basic strengthening progression for your rotator cuff. There's a lot of other different exercises that you can do to help strengthen your rotator cuff that I didn't get into just for the sake of time. So if you want to look on Google or YouTube, there's a bunch of different resources that can show you those different exercises if you want to challenge your rotator cuff even more. All right, the last thing I'm going to talk about is stretching of the rotator cuff. So with any kind of strengthening program, you're going to develop tension or tightness in the muscles, especially for the external rotators, which we're going to be focusing on with strengthening. So it's important to know how to also stretch those muscles to make sure that they have good recovery and good lengthening for your strengthening program. So to stretch your external rotators, we know that if we contract the muscle, it shortens. If we go in the opposite direction, it's going to elongate. So that's what we want to do when we stretch. So the opposite direction for external rotation is going to be internal rotation. So a couple of different stretches you can do for the external rotators is if we bring it into internal rotation over here and kind of apply a pressure downward so we get that internal rotation motion, you should feel a stretch in the back of your shoulder over here. If you're having trouble feeling that stretch or you start to feel a little bit of a pinch in the top of the shoulder, you can modify it by bringing it down out of that 90-degree position and kind of hooking it behind your arm like this, and then pulling your elbow forward so that you're creating internal rotation at a different angle of the shoulder. Cool. So for each stretch, I always recommend holding it for at least 30 seconds. That's just the amount of time that you need to develop a good change in the tissue to create more flexibility, which is ultimately the goal with stretching. So again, for stretching the external rotators, you want to go in the opposite direction, which is internal rotation. You can come in front this way and pull down here, or you can come down here and pull forward with the elbow. All right. And then we know that our bodies are already very internally rotated dominant. So it's going to be very important that we stretch the internal rotators of the shoulder pretty frequently, along with our strengthening program of the external rotators. So same concept, to stretch the internal rotators, we want to go in the opposite direction, which is external rotation. So to do that, we can go into that same position that we were for strengthening the external rotators, except now what we want to do is kind of go away from it. So I'm going to face the wall this time here. I'm going to have my arm against the wall, and I'm just going to turn my body away from it. So now I'm stretching those internal rotators in the front by going into external rotation. Same idea, hold it for at least 30 seconds. And you can do that 2 to 3 times. All right, and the last one is going to be kind of like a corner stretch or a doorway stretch. So over here, if you find a corner of a wall, you can put your arm into that external rotation at that 90-degree angle of the shoulder over here. And then to create more external rotation, I'm going to turn my body away from it. So now I feel a stretch in the front of the shoulder over here. Then hold that for 30 seconds, and you can perform that 2 to 3 times per day. All right, and that's basically all I had planned for you guys today. If you guys have any questions, I'll stick around for a couple minutes to answer any questions you guys may have. I'm trying to look at the chat box to see. Yeah, so there were a couple questions that were asked throughout the presentation. I wonder if we can maybe get these questions in a document and send out with the presentation. If not, that's also okay. If you guys have any questions, you can always email me. I have my email listed on the bottom over here. It's glim@breact.com. Again, I work out of the West Loop Clinic on 225 South Sangamon Street. We're open 6 days a week, and we're available for both in-clinic appointments as well as telehealth appointments. So if you guys have any questions regarding anything physical therapy related or anything that we went over in this presentation, feel free to send me an email or give me a call anytime during the week, and I'll try to get back to you guys on it as soon as I can. We also offer complimentary injury screens. So if you are feeling something and you don't know if physical therapy is the right choice for you, feel free to schedule a complimentary screen, and we can take a look at everything that's going on in the body and determine if physical therapy will help. And if it does, we'll kind of come up with a plan going forward to help treat any pain that you're experiencing. All right, cool. Thank you guys for tuning in the middle of the day for this. I really appreciate it. I'll stick around for a couple minutes if you guys have any other questions. Hopefully I can answer them. All right, thank you. Yeah, so the most recent question that was asked was, and thank you for asking this, it's a really good question, is about training the lat and the serratus, because they're also really important muscles in contributing to how well the shoulder itself functions. That's a really good question. Also a really important factor to keep in mind when training the shoulder. There's a lot more that goes into training the lats and the serratus because they're completely different muscle groups. And that can be covered in a whole other PowerPoint in itself. But real quick, there are different exercises that you can do specifically for each muscle. So the lats, if you guys remember, are those big muscles on the side over here, and they're actually responsible for internal rotation too. So it's still important to train them, but you also want to balance it out with training the external rotators of the rotator cuff with it. One exercise that I really like to do with the lats, not really an exercise in general, but more of like a concept, is eccentric strengthening of the lats. So there's three different types of activations of your muscle. There's the concentric phase, which is shortening of the fibers, and the eccentric phase, which is elongating of the fibers as they create tension. So when you go to throw a punch, let's say you're going to throw a power punch, which might be a cross, in order to control that cross, you want good lengthening control of the lats here to control that motion of that punch going forward. So you can accomplish that at the gym with any lat exercise by kind of focusing more on the lengthening phase of it. So if you were doing a lat pull down, let's say you're situated at the machine here, you pull down here to get a good activation of the lats, and then on the way up, I'm controlling the motion and slowly coming up from it to get a good eccentric or lengthening activation of the lats over there. Same thing with maybe like a row. If you're doing a row, seated row, you're pulling back here, activating the lats, and then slowly coming back. So you're getting that good lengthening activation of the lats there. For the serratus, one exercise that I really like to do that we can also set up with the bands over here. So the serratus actually sits right on the side of the ribcage here underneath the lats. And what it's responsible for is what we call protraction of the arm over here. So one exercise that I like to do is these serratus punches. If you have the resistance band pulling behind you, you can kind of try to push or protract your shoulder in front of the body against the resistance of the resistance band. So another really good question was asking if there is a balance that we need to keep in strengthening the stability versus the movement muscles when it comes to boxing training. Short answer is yes. You always want to maintain a good balance between stability and strength in the shoulder. And to do that, it's always good to incorporate any kind of rotator cuff strengthening along with your current strength training program. I would also recommend before participating in any kind of boxing activity to do the releases that we showed you with the rotator cuff and the ball and moving the arm into internal and external rotation. And then after that, now you know that the rotator cuff is loose and ready for activity. I would recommend doing a couple of sets of those external rotation exercises to make sure that now those external rotators are ready to go for any kind of activity that you want to put your shoulder through. So aside from incorporating it into your current workout routine, whether it's at home or at the gym, I would recommend doing these exercises before any kind of boxing session or training session in order to keep that balance. All right, cool. If there's no other questions, and thank you all for listening in. Again, I think everything should be recorded. So if you had any questions that come up later, you can always go back in to the presentation to look over anything that may have been missed. Also, feel free to send me an email anytime. Yeah, so with scapular dyskinesia, that's it gets a little bit complicated just because there's a lot of different factors that can play into scapular dyskinesia. So scapular dyskinesia is basically poor movement or suboptimal movement of the scapula with any upper arm motions. So because you have so many muscles that surround the scapula and contribute to how well it moves, it's difficult to say that there's one specific sequence for fixing it because it could be an imbalance in any of those muscles. Again, that can be another topic to discuss in a future webinar series. But right now at this moment, it's a little bit difficult to answer that question. All right, thank you.